Hi, I'm Natasha, your care management nursepreneur. Welcome back to the channel where we help nurses launch, lead, and grow care management businesses that make a real impact in our communities and in our lives. Today, we'll be talking about how to start your own chronic care management business and work from home, even if you've never run a business before. Let's get into it. First, what is chronic care management? CCM is a service that's recognized and reimbursed by CMS, the Centers for Medicare and Medicaid Services. It allows physicians and other eligible providers like nurse practitioners and physician assistants to bill insurance monthly for ongoing management of patients who are living with two or more chronic conditions. So let's break that down with examples. If a patient has type 2 diabetes and hypertension, or congestive heart failure and COPD, those conditions qualify. These are long term progressive conditions that require regular support between visits to the doctor. That's where you, the nurse care manager, comes in. You're the one checking in with the patient, educating them about their condition, updating their care plan, coordinating referrals, and making sure they follow their treatment plan. An example of care management would be you speak with Mr. James once a month. He's 67, he's diabetic, and he also has high blood pressure. You work to help him understand how his medications work, how he should be taking his medication, his side effects, and that the side effects, and then also encourage him to check his blood pressure daily. And then if he needs to have a referral to a podiatrist or eye doctor, you would coordinate that as well. And all of this is billable under CCM. And the beauty of it is that all of this can be done remotely using systems and structures that you create to ensure that you are meeting the patient's needs. So, why is CCM the perfect business for nurses to start from home? Here's why the model works so well for nurses. It's paid for by Medicare and Medicare Advantage plans. They reimburse for the services monthly. So you have recurring revenue. You don't need a physical office. You're using your clinical skills, teaching patients, coordinating care, and really just caring for that patient individually so they're actually living healthier and more engaged in their care. It fits into your lifestyle. So even if you still work full time, you can coordinate care around the time that you work and you get to know the patients. And CCM allows you to package your skills into a billable service. And yes, nurses really do own their own care management businesses. But what most nurses don't know is that you can offer this as an independent contractor, or you can partner with a physician and they bill the insurance company under their NPI and you provide the service to their patients and you get paid for your time. Usually that's a flat fee per month per patient, and you don't need to go to school. You don't need to go back to school or get a new credential to work as a care manager. Your nursing license qualifies you, your RN license qualifies you to work as a care manager. But what you actually need to do to start a CCM business from home is you need to ensure that you have your nursing license, that it's active. That's your foundation. You don't need any additional certifications, even though you can choose to learn more through online certifications and mentorships and other training. You want to ensure that you register your business, start simple, LLC, sole proprietorship, and file with your state and get your employee identification number from the IRS. That's free. And then you want to choose your professional business name and secure a HIPAA compliant tool for documentation and communication of your CCM services, and also to help you create your care plan. So now one of the big questions is, how much can you earn as a nurse doing CCM? So let's do the math. Say you manage 50 patients a month. You're paid $35 per patient by the physician. And that $35 is really just for the first 20 minutes of seeing that patient. So that is $1,750 a month. Let's say you scale that to 100 patients. Now you're making $3,500 a month, and you can do this yourself, or you can hire another registered nurse or nurse to help you and keep growing. That's how you build an agency, a business, and it's not just a job or a side hustle. So, how do you partner with providers to offer these services? Doctors care about outcomes and practice efficiency. They also care about increasing their practice revenue and reducing the workload for themselves and their staff. So you can create a one-page overview of your services and offer the services to them. And once they work with you, they will see improved engagement from their patients. They'll see the better documentation, and then they will also see an increase in their revenue. And that is going to keep them wanting to keep going with you. And the goal is to start locally with providers in your area. So you want to join a mentorship or a coaching program, much like mine, to help guide you through the setup, the documentation, and the contracts that you need for starting your CCM business. Remember, it's not just a side hustle. This is a sustainable and scalable nurse-led model that actually puts you in control of how you use your nursing license. You're already qualified. You just need the right systems and support. And of course, the belief that your nursing expertise is enough to launch and lead this business. So if you're ready to turn your nursing skills into a business that changes lives, grab my free step-by-step CCM business launch checklist, or check out my mentorship program where I help you start, scale, and succeed. Don't forget to like, comment, and subscribe. We're transforming healthcare one nurse, one patient, one practice at a time. Thank you so much for joining me today.